the doctor that I went to, Dr. Joseph Aarons, is a preventative medicine doctor. And he's one of those rare doctors nowadays that is absolutely slow motion when it comes to prescribing medicines to his patients. He could have made a mint. He could have made a lot of money as a preventative medicine doctor, but he didn't want to prescribe the drugs. He took a very, very meager salary. So my dad for close to 2 decades was trying to get me in to see the guy for a stress test, and now I wish I had done this 2 decades ago, but better late than never, right? And in this case, yeah, it is way better late than never. So without me talking anymore, let's get right to the results. Okay, so the results of the stress test show that my C-reactive protein is a 0.2. Anything under an 8 is stellar. So what is CRP? CRP is C-reactive protein. I'm reading right from the internet. I Googled it. Okay. All right. C-reactive protein. So I'm just going to read this and explain it to you. Why it is so important to do the snake diet. When you empty your bloodstream of all the garbage that is offered out there for us to eat, and you just stick with the basics: meat, eggs, milk, root vegetables, and snake juice, salted water, amazing things happen. So, C-reactive protein is a plasma protein that rises in the blood with the inflammation from certain conditions. C-reactive protein is one of the plasma proteins known as acute phase proteins. Proteins where plasma concentrations increase or decrease by 25% or more during inflammatory disorders. So what it is it's a marker that you can get in a blood test that detects the inflammation in your veins and arteries, capillaries, right? It's your cardiovascular system. It's the health of the tissue of your veins. Okay, so CRP is usually measured in milligrams per liter of blood. Normal CRP levels are below 3 milligrams per liter. Mine is 0.2 milligrams per liter. Okay. A high level of CRP in the blood is a marker of inflammation. High CRP levels can also indicate that there's inflammation in the arteries of the heart, which can mean a higher risk of heart attack. However, the CRP test is an extremely nonspecific test, and CRP levels can be elevated in any inflammatory condition. So, even though they're saying that it's a nonspecific test, it's still a marker for inflammation, and inflammation is not a good thing to have just walking around in your arteries and in your veins. Inflammation in your muscles due to heavy lifting, due to strength training, is a result of strength training, and that is fine to have inflammation, to have sore muscles. That's fine. C-reactive protein is a sensitive marker of inflammation. It rises quickly after an inflammatory attack, but should return to normal levels. Elevated CRP signals increased risk for many chronic inflammation-related disorders, including cardiovascular disease, cancer, diabetes, obesity, and more. Okay, so what is Cole Robinson, and what am I always trying to get through to people about the snake diet? And it's this, is that when you take out the substances that come into your bloodstream from eating a bunch of garbage, or from eating in general when you need to fast and drop your weight, get into ketosis, you are eliminating substances that are irritating the lining of your arteries and your veins, that are taking years off of your life, that are causing scar tissue. And when you have scar tissue in your veins, you get plaques, which are scabs, which turn into blood clots. And when those release, they give you pulmonary embolisms and strokes and heart attacks. This is why it is so important that you do some sort of fasting, if not go all out on the snake diet. I lost 160 pounds that we see in less than 7 months on a snake diet. But let me tell you, I did some screwing up and I had to backtrack, so I probably lost over 250 pounds when it's all said and done from playing catch up. But now I seem to be in a pretty good place, and I want to leave you guys with this video here, and I hope that you like, subscribe, definitely share this video, and comment down below. Okay, so let's take a look at test results. Okay, now when I took the first stress test 7 months ago, my doctor determined that my BMI was 46.8. Now at 250 pounds, using this formula, my BMI is 34%. That's a big drop, huge drop in 7 months. Now on the stress test, when I first took it, my blood pressure was 150/90. When I took the stress test the second time around, 7 months later, it was 118/70. Okay. Now, that was 150/90 is abnormal. It means it's not good. It means I was not in good shape. This is good. It means I'm very good shape. All right, now let's keep on going, and we'll find some other really good things that I think are ultra important. And you know, sometimes the numbers just wouldn't make sense. My recommended body weight is 182, which I'll never be able to get to at my age doing what I'm doing. It just would be horrific if I were to get to 182 pounds. I would be emaciated. I would be absolutely in danger of dying because I would be way too skinny. But all right, let's look at the laboratory data, and this is what people want. This is the science. Okay, now I'm bringing you the science because I can bring it now. I can bring you the science. This is the hard data right from my blood. Comparative analysis. Snake diet. What it will do for you. It will reverse the freaking aging process, damn near. It will add life to your life. Not just a little bit. I'm talking about decades. When I took this stress test, I had the physiological age of a 70-year-old man. Now I have the physiological age of a 48-year-old man. That's a significant addition of life. And let's just get right into the numbers. Okay. Glucose. Let's look at glucose. Glucose, when I came in, blood glucose was 80. Blood glucose 7 months later, 73. Uric acid. This is an indicator of kidney stones, of potential to have kidney stones. And my mother had kidney stones, and it is inherited. You inherited your propensity to have kidney stones from your mom. So my uric acid is supposed to be between 2.5 and 6.5, and it's 11.8. Now let's take a look at my uric acid, which is 5.6. So he is not worried about my potential for kidney stones. And if you want to prevent kidney stones, stay hydrated. Don't let urine sit around in your kidneys and just sit there and get stagnant. You have to keep liquids flowing through all parts of your body. Okay? My doctor sent me a a letter in the mail a week or two ago, but I wanted to make sure I talked with Cole to make sure that I knew exactly how to go about this video, and let's get right into it. Okay, so this is probably the most important video that I've ever put out, and I'm going to talk about the difference between my two stress tests. The first stress test I took on March 27th at a body weight of 340 pounds, and the second stress test I took on November 10th at a body weight of 237 pounds. And the differences are staggering. And what this means is that if you're in any doubt of whether the snake diet is a healthy diet, whether it is good for you or bad for you, I'm here to tell you that it is one of the best things, if not the best thing, you can do for yourself if you are extremely overweight. And yes, the snake diet is an extreme diet. Fasting forced ketosis is not an easy thing to do, but without any more delay, let's get right into the test. Okay, so I've had my blood taken, a couple EKGs taken. Now I'm going to be hooked up to the electrodes and get ready to do my stress test.
We're going to take you around to all the Weight Watchers meetings around town.
Whatever I can do to help, you know, whatever I can do.
Congratulations.
Thank you, thank you, thank you. This is Dr. Joseph Ahrens, my preventative medicine doctor, who performed a stress test. And what did you perform? What did we do today?
Today,
Yes.
it's a maximum stress treadmill test.
Okay. And we took blood and urine.
Some blood studies for just interest and investigation.
Okay, okay. And compared to the last time I was here, which was 7 months and 2 weeks ago, I was 103 pounds heavier.
And you doubled your time.
And I doubled my time on the treadmill. And I have the chronological age of 45, but the physiological age of...
I think you're 42.
I'm 45.
Yeah, I know, but the physiological age I think was 42.
Physiological age is 42, so I'm 3 years younger than what the data says.
The average American male.
Than the average American male. Okay. And my my EF, or ejection fraction, meaning how much blood is pumped per beat,
Per stroke, right?
per stroke, has increased significantly. Would you say?
Probably 30-40%.
30-40%. So I have a stronger heart. And
stronger muscle.
And the premature ventricular contractions. Did we have any of those in the EKG? Because I remember we had 13
Yeah,
PVCs.
None today.
So we have no premature ventricular contractions?
Zip.
Yes. That is that's awesome. Because I didn't think they were all going to be gone, but they're all gone.
Well, I didn't either, but look at the dramatic changes you've effected.
Wow. And I have to tell you that this fasting diet, I held to it like grim death.
Interesting choice of words.
Yeah, exactly, right, yeah. I know, yeah, I'm a poet and don't even know it, right? Okay, so
I'll get these things confused. Go ahead.
the next time I come back, I want it to be a year from now. I want it to be a year from now, which would make it March 27th, 2018. And the goal is to last 19 minutes on the treadmill with 12 METs.
Okay.
And the 12 METs is the metabolic equivalence, or a metabolism that's the equivalent of
I think it was a 32-year-old.
a 32-year-old at in a 46-year-old body.
Right.
Right. So if I hit those numbers, then I've jumped in a time machine, so to say.
With a woman chasing you down the street.
Hey, like the Beatles. I'm trying to be like the Beatles. Yeah, this was a great thing today. I'm really happy that I came in. And the testosterone. I wanted to ask you a question about the testosterone. And two things: testosterone and calculating my BMI. First, the testosterone is. Do you think because when I came in the last time, I was 11 days fasted, and I did the treadmill test while still fasting. But now I came in and I did the treadmill test on 73 hours fasted. Same conditions. I had salt water. I was drinking my salt water while preparing to come in today, just like I was the last time. But I was wondering, does food affect the testosterone level, or does the fasting affect the testosterone level? Because my testosterone the last time was, when we talked a few days ago, you said that it was above average.
Testosterone?
Yeah.
Okay, the number was 431, right?
431, and that would be,
And the range is 240 to 830.
okay. Oh, here's my testosterone, 431. Okay. All right, so I'm hoping that my testosterone will be higher than 431 this time around.
It's servicing less tissue, so it should be a little bit higher.
Okay. All
As,
right.
as a percentage.
I see. So, right, because all tissues make use of everything in some way. So if you're fatter, then your testosterone is going to be distributed to more cellular
More stress on
material.
More stress on the gonads.
More, okay, right, okay, I see. And so 431 is what's average?
240 to 830 is the range.
40 to 830. Okay, so I'm kind of like right in the middle of the road.
Right.
Okay.